Hey everyone, we're the Note Ninjas. I'm Nicole, the occupational therapist, and I'm going to be showing you today a technique for bed mobility, focusing on emphasizing large, big movements. Okay, so this is a technique for that you want to work on for patients who maybe have a neurological disorder such as Parkinson's disease that are making like smaller movements. So what we want to do is we are going to train them in making large movements, okay? Because their brain is telling them that they are making these movements, but really, when they go to carry out the movement, it's a lot smaller than what they think. So we need to focus on emphasizing that large movement, okay? So we are going to be showing you a demonstration, doing some bed mobility, some bed exercises. So you want to start getting on the edge of the bed. This is my bed. It's a little bit higher, so you might need to adjust depending on the patient's bed. If they have a hospital bed, you could lower it. But we want to just start by just sitting down, okay? And then you're going to do a big swing. And then you could just practice. You could do repetitive movements of a big swing, big swing. What you could also do, I'll show you, put a band here, okay? And this is for someone who might not understand the concept of big movements, okay? So we want to use this visual cue and instruct the patient to swing the leg over the red band, okay? So red, big swing, okay? We're going to keep practicing that movement. Now, it might not be as easy for a patient to do it just like I did. That's why we need to practice. That's why we need to be repetitive. So bigger movements, emphasize that bigness, okay? So once we get over onto the bed, big, and then big. And once again, we can practice that together. So we can just go back. So we could do one step at a time and then go back and put it together. So big, 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 big. All right? So large movements. Big, big. Okay? Shift into the middle of the bed. Now what we want to do is bring our arms out to our side. And then we want to do big movements. Okay? So they might be doing like this. That's not good. We need to big. We can clap. Use kind of like a metronome. Clap. Clap. If the therapist is standing right there, put out your hand for them to clap, okay? Sometimes it's better to have like that external cue. Clap. Clap. And then you want to make it even, so try to do both sides if you can. Clap. Clap. Okay? And then another one we could do to practice rolling, bring the leg up. Big. Just do this repetitively. Bend the knee. Stomp. I like the stomping, okay? Make that stomping. It's more of an external cue. It'll motion for them to emphasize the movement. Okay? Stomp. And then do both sides. And then let's put it together, okay? Bend, clap. Bend, clap. Bend, clap. Bend, clap. Okay? So these are all exercises that you could do to set them up for getting in and out of their bed. So now let's put it all together. Bend, clap, roll, okay? Bend, clap, roll. All right, and then out of the bed. And there you have it. So make sure to follow the Note Ninjas for more skilled clinical techniques and documentation.